It's Wednesday, April 22nd, and time for your Barbados Today morning news update. The Caribbean is being urged to accelerate and expand testing for COVID-19. The recommendation from the director of the Pan American Health Organization, Dr. Carissa Etienne, who also said it was vital for all countries to actively embrace preventive measures while preparing for more cases, hospitalizations, and deaths. Dr. Etienne suggested that the numbers being recorded were not a true reflection of how widespread the virus was in the region and in Latin America.
We are fighting an invisible enemy, not just because the virus can't be seen with the naked eye, but because we don't have a full picture of how COVID-19 is affecting our societies. This must change. We need a clearer view of where the virus is circulating and how many people have been infected in order to guide our actions. It is important to accelerate and expand testing to track the spread of COVID-19 in the Americas. Expanded and decentralized testing will help us better monitor the trends of the pandemic within each country. This also helps governments introduce, reinforce, or adapt public health measures such as social distancing. Expanded testing will also allow local health authorities to implement and strengthen contact tracing to quickly isolate suspected cases and to break the chain of transmission in communities.
Addressing PAHO'S weekly virtual media briefing on Tuesday, Dr. Etienne conceded that ramping testing capacity for COVID-19 was a challenge for many countries in the region. However, she said the organization was working closely with countries to address the situation.
In these challenging circumstances, what do we as PAHO recommend to our countries? First, expand lab capacity. Countries are encouraged to scale up testing for COVID-19 by using all of the public and private laboratory capacity available at the national level. Second, prioritize according to availability. When there are limitations, we need to prioritize patients with symptoms, contact trace, and follow up with those that may be infected. Third, ensure access to all. Testing should be free of charge to patients. High prices create a barrier between a patient and the treatment that he or she desperately needs. We need to expand access so that everyone who needs a test gets one. PAHO will continue to work with member states to make these recommendations a reality.
Meanwhile, PAHO has boosted Barbados' COVID-19 testing capabilities with a donation of 11,000 testing kits. Health and Wellness Minister Lieutenant Colonel Jeffrey Bostic accepted the kits as well as 782 personal protective equipment packages from the PAHO and WHO representative for Barbados and the Eastern Caribbean. Speaking during the handing over ceremony yesterday, Bostic revealed that health authorities were now in possession of 38,000 testing kits and that number was expected to rise soon. He thanked PAHO for its donation.
We have reached where we have reached because we are not alone, and we have not been alone. We have been receiving the assistance of the Pan American Health Organization all of the way. And it is not only in terms of the technical assistance, the provision of equipment and so on, the advice and the support, but we've been following the protocols that were established to deal with such an activity, such an event. And by following those protocols, I believe that we've been doing the right things at the right time.
Government is also now in possession of additional medical equipment to aid in its fight against the contagious virus. According to a source close to the situation, 5 NKV 550 ventilators arrived on the island yesterday. Shortly after arriving, the ventilators were loaded and delivered to the island's newest isolation facility for COVID-19 positive cases at Harrison's Point, St. Lucie, where they were installed. The source said while no timeline had been set, it was expected that 25 additional ventilators would be in Barbados soon. There has been no evidence that persons who have recovered from COVID-19 are being reinfected. So says Acting Chief Medical Officer Dr. Kenneth George. Of the 75 confirmed cases of COVID-19 on the island, 25 have recovered so far, and Dr. George says authorities are monitoring this particular aspect of the pandemic closely.
Still learning internationally about this disease. Remember, we've only had experience with this condition for the past 3 months. So the issues of persons being reinfected is not clearly known at this point in time. However, we have been monitoring patients in our institution who have not immediately or over a 2-week period converted. So we are, in the sense, using all options available, including the small possibility of reinfection with those persons who haven't cleared.
There's regional and international news after this short break.
Barbados Today, news you can trust.
To news from the region. As the Caribbean continues to grapple with the COVID-19 pandemic, authorities in the Bahamas are reporting that some 18,000 people have submitted claims for unemployment benefits. We get more in this report from ZNS.
The long lines at the National Insurance Board that made national headlines last week have totally been diminished. Director of NIB, Dr. Nicola Virgil-Rowe, telling reporters during an online press conference Tuesday that she credits the diminishing of those long lines to the hardworking staff at NIB. She also gave the media an update on the thousands of applications that have been processed for the unemployment benefit.
We look at around 18,000 have now been processed at looking to have a payout of 8.7 million. So since the Prime Minister would have made his statements, we have done even more over the weekend. Our staff have continued to work in order to get out even more of those. We still have a few thousand left, and we're getting in new claims from the Department of Labor as well. And so we're just making sure that, and cross-referencing those to make sure there's no duplicates there. But we have gotten in some claims that we're working on from there.
The NIB director specified that the unemployment benefit is paid to compliant NIB contributors.
And finally, the United Nations is warning global hunger could double as a result of the coronavirus pandemic, putting 265 million people at risk. A new report by the World Food Programme said the impact of lost tourism revenues, falling remittances, travel and other restrictions linked to the pandemic is expected to leave about 130 million more people acutely hungry this year.
Today with COVID-19, I want to stress that we're not only facing a global health pandemic, but also a global humanitarian catastrophe. Millions of civilians living in conflict-scarred nations, including many women and children, face being pushed to the brink of starvation, with the specter of famine a very real and dangerous possibility. Lockdowns, economic recessions are expected to lead to a major loss of income among the working poor. Overseas remittances will also drop sharply. This will hurt countries like Haiti, Nepal, and Somalia, just to name a couple. The loss of tourism receipts will damage countries like Ethiopia, where it accounts for 47% of its total exports. The collapsing oil prices in lower income countries like South Sudan will have an impact significantly where oil accounts for 98.8% of total exports.
That's news. But for the very latest, visit us at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media in bus terminals, as well as screenplay at supermarkets and gas stations near you. And you can also hear us on Mix 96.9 FM and Capital Media HD 99.3 FM.